Hey people, it's great to be back on Sharing with Yemi. Thank you so much for joining me today. Wherever you are in the world, it's a beautiful Thursday and it's great to be alive. It's great to know that you're there and that you can hear me and that you as well are keeping well and you're staying safe and you're staying healthy and that your family are well. I really hope that you're keeping well and that you're adhering to all the rules set in your various countries and your cities to stay safe at this very challenging time. It's great to be back on Sharing with Yemi. And today we really want to honor all our frontliners, those who are putting themselves on the front line, trying to keep us safe and healthy and ensuring that we're constantly doing all we can to fight this pandemic that is taking over the world. Uh, some of you who are going to join us today are health workers yourself. Some of you are those who want to appreciate health workers or anybody who is on the front line, our firefighters, those who are traveling, bringing in medication from different parts of the world, those who are doing different things to ensure that we get the treatment that we need or that we require. They're all frontliners. And sometimes people don't show enough appreciation. Today, we want to dedicate this hour of Sharing with Yemi to say a massive thank you to all these amazing people who ensure that those who are ill, who get into the hospital, are given the best care possible. And with fingers crossed, they support these people to get home safe and sound. So we're going to kick off with this really wonderful message from our Irish Taoiseach, Leo Varadkar. So many messages been going around, but this is so heartwarming and it's an appreciation to all our frontliners. So we're going to start off with this today, a message from the Irish Taoiseach, Leo
Family have
Varadkar.
spoken about little else in recent days. My partner, my two sisters and both their husbands are working in the health service here in Ireland and in the UK. They are all apprehensive. They've heard the stories from China and Italy of hospitals being overwhelmed and medical staff getting sick. I'm so proud of them all. Not all superheroes wear capes. Some wear scrubs and gowns. And all of our healthcare workers need us to do the right thing in the weeks ahead. Our community services and hospitals are being tooled up. Essential equipment is on the way. Retired staff are returning to service. People are training for change roles. This is the calm before the storm, before the surge. And when it comes, and it will come, never will so many ask so much of so few. We'll do all that we can to support them. I'm also grateful to the many people who have joined this great national effort, not just our healthcare staff, but also our army cadets, our librarians, our civil servants who are now learning to do contact tracing, the early education and childcare workers offering to look after children for our frontline staff so they can go to work, the teachers and lecturers finding new, innovative ways to teach students online and putting together contingency plans for the Leaving Cert and college exams, the people who are stocking our shelves every day, and those who are serving customers, our hauliers who leave their families on a Sunday evening and travel across the continent to ensure that we have the products, medicines and equipment that we need. All those who keep our supply chain moving, working in transport, we thank them. It's a frontline service too. Our journalists and broadcasters who are helping us to inform and educate the public are all deserving of our respect and thanks.
Warming message there from the Irish Taoiseach, Leo Varadkar. Thank you so much for that message. And it somewhat opens the floor for us to begin to show appreciation for our frontliners. All the different people that he'd mentioned there are amazing frontliners. So I'm going to encourage you to call today if you know a frontliner, somebody who's putting their own life at risk to ensure that we're safe and that those who are in the hospital who need help are getting all the care in the world. I would encourage you to call today. The number to call is +353 87 7621 660. You can call directly or you can call on the WhatsApp. I've got a number of guests today who are joining us who want to either appreciate a frontliner, who are leaving with a frontliner, and have to leave with the scare of even contracting the virus themselves. So I'm going to start with Vincent here. Vincent is joining me. Hello, Vincent. How are you today?
I'm good, I'm good.
Hi, how are you
Yemi, how are
keeping?
you?
I'm good. How is your family, Vincent?
We're all enjoying the house quarantine with my kids.
Oh,
Yeah.
hi, guys.
And we're actually having a flower planting.
Ooh, very nice.
Yeah.
Very nice. Now,
Yeah.
Vincent, your wife is a frontliner.
Yes, yes. She's a
Your
nurse
wife
in
is,
Navan.
she's a nurse, yes, and she's working in the hospital. What's that like for you guys at home now?
Would you like to talk to my wife or are you just asking me?
Oh, yeah. Well, I'm asking you first, and if she's home today, I would love to talk to her. So let's
Okay.
ask you first. What's that like for you?
For me, as a husband, there's worried, but I am happy for him as one of the frontliner because she is actually ready every time she has work. But I told her that we must pray and we have to protect ourselves. We have to follow the protocol of the government. We
Mm,
must be a good abider so that we contain the said COVID-19.
mm,
And just to contribute it to the community,
mm.
we are following also the social distancing,
Very good.
and of course we are updating ourselves through the news of the HSC, the television news, the updates, and of course you're there as our representatives. We are looking also with your updates. Thank you.
Thank you so much, Vincent.
You're
Is
welcome.
your wife, is she around today? Can we have a chat with her just to share from her experience?
All right.
You're going to try and grab her now.
Yeah.
She's busy somewhere, so we're exploring your
Yemi is
entire house today.
saying hi to you for the
Hello.
COVID. Yeah, she's actually planting the trees here.
Not
Oh, that's
trees.
so
Ano,
nice. You're
flowers.
keeping busy.
Fairy
Hindi naman ano
plants.
yung ano, sinagano sa kanila. Oh, here. Lagyan mo.
Hey, I want another one.
No, 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 no.
Oh,
Oh,
Hello.
lagyan
how are
mo
you,
kasi.
my dear? How are you keeping
Yan. No, no,
today?
no. They're talking about the...
We're busy.
You're very
Maybe
busy. I can see you're planting, which is brilliant.
these children, they are they have no school.
I
So
know.
we're
You're trying
doing
to
some
keep them busy.
yeah, so we did fairy plants, fairy garden.
Very good. Very
So
good.
I don't know the activities tomorrow.
Oh,
Say
well, I'll tell
hi.
you something. Hi. How are
Hi.
you, darling? Can you sing a song for me before I talk to mommy?
Oh, sing a song. Vera. Edelweiss. Okay. Okay. Okay, just wait. Just wait.
Okay, sing
No,
us a
Dad, I will
beautiful
sing.
song.
Edelweiss. Just wait. Edelweiss. Okay, come on, Edelweiss.
Edelweiss, Edelweiss.
Okay, just wait. Edelweiss. No, sila lang naririnig. Okay, sing. Edelweiss.
Okay.
Edelweiss. Edelweiss. Every
Every
morning
morning
you
you
meet
greet me,
me, small and
smile,
Ang ganda
wise,
dyan.
clear and
clear and bright.
bright. You
You
have
have
to
to
stick with me, blossom of snow may
blossom
we
of snow make
bloom and
you
grow.
and
Blue will
blue,
grow
blue
forever.
forever.
Edelweiss.
Bless, bless my heart. Oh, that is so
Hello,
beautiful.
Yemi.
Thank you, guys. Thank you so much.
That's we.
That is
That's
beautiful.
our pastime bonding.
Oh,
Singing
fantastic. Thank
new
you. And I'm
songs.
sure everyone will appreciate that. That was so
Ouch.
heartwarming. Now, tell me very quickly, tell us, because people are watching, what's your experience? What's been
Sorry,
your
they are
experience so
very.
far? No problem.
They keep
You're a
on.
frontliner,
Huh?
you're a nurse working in the healthcare system.
Yes.
What's your experience like so far with the pandemic?
At the moment, because I am with the autoimmune diseases, patient
Y-
with autoimmune diseases. So
Yes.
I am giving them treatment. I'm not at the moment assigned to the isolation ward. As much as possible, they don't want me to be assigned to any infected areas. I would. I need to keep myself uninfected. So yeah, I am just dealing with them in the away from the hospital. Oh, not really away. The building beside the hospital.
Yeah. And
Um,
what has the for people who are your colleagues that you hear the work they're doing in the hospital itself, what is the news you've been hearing?
here in Navan,
Yeah,
there's no. We have no
in the
confirmed.
hospitals, in the general hospital.
We have no confirmed cases of COVID-19 yet here in the hospital.
Okay,
Whoever
in the yeah,
positive, they are self quarantined. They are at home,
okay.
but nobody is admitted at the moment. But there is, as of not this week, last weekend is the one I've heard. They have six, but they are negative.
Oh, very
So
good,
it's
very good.
not the coronavirus. It's different kind, or
It's
maybe
a
flu.
different thing. A
Yeah.
different thing.
So
So, as a
far,
healthcare worker yourself, how does it
yeah.
make you feel to see that nurses have to be in the midst of this, have to put themselves at risk to ensure that lives are saved? I know that's the work of a nurse, but this is even more demanding of nurses.
It's
How does that make
actually,
you feel?
of course, it's worrying. You know that a kind of you might get infected yourself, and you don't want to bring it home. Anybody could be infected. So yeah, we're worried, but at the same time, being nurse is a calling. So it's at the moment we are frontliners. We have to do this. You know,
So, what words do you have for people out there to make your work easier as a nurse? What word do you want to share with
I
people?
always tell, even in social media, I'm so active,
Mm,
always advising them, stay at home.
mm,
We are trying to contain the spread.
mm.
It's hard to say we would stop it, but try to lessen. We're trying to contain, as we are still waiting for the vaccine. We're still waiting for the medication. At the moment, we don't have it yet here in Ireland, so we're still waiting. So while we're waiting, uh, everybody should follow what the government has advised them. Stay at home. If they're not going to do any important business outside, stay at home. Better to be safe than sorry. I always
So
advise
much.
them that it's better, you know, at home. I actually was talking to my mom. Do you know Yemi, in the Philippines? Um, in the Philippines, it's all
Yeah.
locked down. I mean, each town, they have to stay there in the town where they are. They're not allowed to go in any other town. They have to stay
Wow.
there. Yeah,
Wow.
it's so strict. Military, unless they are working, they have to show that they are working. They have to have evidence that they are working in that city. So here in Ireland, I was thinking, if if it's possible. But I'm not advising them, but it's the government's, it's them to
It,
decide,
yeah.
to prevent. We don't want to be like Italy. We don't want that to
Mm.
happen.
And
It's
that's the
at the
problem.
moment.
People just don't listen to the call to stay at home.
Oh,
Everyone is saying stay at home, but people don't seem to listen.
you can still see some going outside, but I was just, at the moment they are more curious, they are more cautious, I see them wearing mask, I see them having their 2 meters distance, they are very
Mm,
careful. I can
mm,
see them have their own hand hygiene. You can
yeah.
see they are trying to keep themselves protected, which is good. And I haven't been in Dublin. That's why I cannot say anything about
Mm,
here in Ireland. But in Navan, I'm so glad that they are following. So far, they are very, what you call that? They are very
they're very
obedient.
cautious and obedient.
Obedient,
Big up
yeah.
for the Navan. I'm so proud of my Navan people. Big up. Listen, one or
Yes,
two
they are very
people,
obedient.
if I get you guys, you're in big trouble. If you live in Navan and you're not obeying, you're in big trouble. But so far,
Yeah.
I have to say, people have been very, very obedient and are cautious in Navan and are listening. And thank you, everyone, for that, because you make the work of our frontliners easier when you obey. Thank you,
Yeah.
guys. Vincent, um, what do you have to say to your beautiful wife sitting beside you there for being a frontliner?
What can you say about me being the frontliner?
I am proud of my wife.
He's cooking me food all
Oh,
the
Yeah,
time,
because
keeping me healthy.
she is
very good.
actually positive that they're gonna look after the possible COVID patients.
Yeah.
uh,
Thank you guys so much.
yes.
Thank you
Thank
for
you.
adding us, especially to my compadre. He never forget me if there's a like this. Thank you.
Oh, you're very
We are
welcome. You're very
Yeah, we
welcome.
are
Thank you
proud of
guys for
you
sharing
because
with
you are
Yemi today.
representing not just Nigerian, you're
Mhm.
representing us also.
Yeah. You know what,
Thank you.
Yemi? Another thing I will tell you here in Navan, the management, the doctors, they are very initiative. They already
Mm,
have this plan. This algorithm. If we see
yeah.
even one or two symptoms, we know what to do. If it's in
Mm,
the casualty, if it's in the anywhere, there's a guide already what to do.
Yes,
They are prepared at the moment, well prepared. We're actually
there's a plan A, B, and
yes.
C.
If worst come to worst,
wow. Wow. That is
it's hard to
amazing.
say we are ready. No one will
Yeah.
be prepared, but we have plans.
Very good.
It's
And
hard
I'm
to
happy
say
to
it.
hear that.
Yeah,
It really
it's hard
gladdens
to
my
say
heart
we're
to
ready.
hear that. Thank you so much.
Yes.
Thank you, Vincent. Thank you, Marina, for
All
sharing with
right,
us today. God bless you. Thank you
you're
so
Mind
much.
welcome.
yourself.
Okay,
Thank you.
Stay
We
bye.
safe
will.
and
We're trying to
healthy.
keep safe as well. Thank you,
Yeah,
guys. God
you're
bless you.
welcome. Bye.
Such heartwarming news. And I want
I'm Nick, and we are the Belfast Respiratory Team. We are now in the greatest medical crisis of our lifetime. Stay at home.
I'm Angela, one of the respiratory consultants. This is the crucial time. This is not a rehearsal. You will only have one chance at this. Stay at home.
I'm Cllr. I'm a respiratory nurse. You can play your part to enable us to play ours. Please stay at home.
I'm Julian, a respiratory consultant. We all have a choice. If you choose to stay at home, you will save lives. Please, stay at home.
I'm Susie. I'm a respiratory consultant and I've been a doctor for 35 years. We are facing our greatest challenge and we're frightened. Help us. Please stay at home.
I'm Siobhan. I'm a respiratory physiotherapist. I know where my kids are. Where are your kids? Keep them at home. Stay at home.
I'm Roshing, a respiratory nurse. Doctors and nurses have died. We need to stay healthy so we can help you. You can help save our lives. Stay at home.
I'm Anne-Marie, respiratory nurse consultant. Thousands of people could die here. Help us reduce that number. Play your part. Save a life. Stay at home.
My name is Thelma. I am a respiratory consultant. You've heard my colleagues. This is a crisis. Please stay at home, we beg you.
Okay, it's good to be back. It's crazy. We were disconnected there and it was trying to find back technology. You know, this is the crazy thing about technology. when it develops a mind of its own, you're wondering what's going on. And then you're trying your best to get it back. But it's great to be back. And I really want to say a big thank you once again to our frontliner, to Vincent's beautiful wife, Melissa, who has shared her experience with us. Thank you so much for the great work that you're doing. You are a superhero. As far as we're concerned, you're a superhero. And we've been receiving calls, so you have a chance to call in and to show appreciation to a frontliner that you know, a frontliner who you want to say a big thank you to. So I have joining me from the UK, a frontliner as well. Can you hear me, Mr. Olaleye?
Yes, indeed, I can. Good evening.
Hello, sir. Good evening. How are you?
I am fine, thank you. How are you too?
Very good. I'm brilliant. I can see that you're traveling. You're in the train. Am I right in saying that?
You're right.
What's your day been like? Tell me, what has your day been like?
Oh my God, it's been hectic.
Wow. You're a frontliner
Very, very
yourself.
hectic.
Are you coming from work? Are you coming from work now? Okay, we're going to try and reconnect
Yes,
that. Oh, yes, you can hear me now.
yes, I can.
Yes. Are you just coming from work now? Are you on your way home from work?
Yes, I am on my way home.
Wow. What was today like for you in the hospital?
Well, it's been a very hectic day. We've got to get prepared for what someone has described as a tsunami of COVID-19.
Wow.
In anticipation of what is coming ahead, we've had simulations, we've had local policies drawn up, we've had guidelines, how to treat patients, how to recognize. It's been really, really, really hectic, like army drills.
Wow. So tell me, for yourself as a frontliner, do you feel a bit worried that you have to leave work and go home and meet your family? And then when you get home, do you do a kind of self-isolation from your family?
Well, that's an understatement. Getting worried is an understatement because the three of us actually believe it. We are frontliners.
Whoa.
I work in the hospital, my wife works in the hospital, and my daughter, because there's no school now, helps out at the local Asda shop. So the three of us go out and we come back very tired and worried as well.
Oh my goodness. So tell me, what's your daily routine when you return home? What do you do to keep safe?
Yeah, the first thing as soon as I get home is to have a shower, and I encourage others to have showers as well. Have shower, try and clean up as much as we can, because like the three of us had gone out, and who knows who have contracted what. So, but the
Wow.
first thing is the personal hygiene.
Wow. Okay, I will say hold on there. We have people joining us from different parts of the world and people calling. Let me see if I can take a call here. Hello there. Hello, can you hear me?
How are you? My name is Adenuga. I'm from Lagos, Nigeria.
Hello, Ade. You're live on Sharing with Yemi. Thank you for calling from Lagos, Nigeria. As you know, on the show today, we're talking about our frontliners and we're appreciating them. So tell me, what are your thoughts about our frontliners? And do you have any words of appreciation for anybody that you know who's a frontliner?
Absolutely. I mean, that's actually why I'm calling. I think our frontliners actually deserve all the appreciation and all the remembering that we can give them now. I mean, basically, I'm in a different line of business. I've been home for about a week. I have the choice. I have an option to stay home with my children. But these folks, everyone in the medical world, our doctors, our nurses, our pharmacists, they have no choice. They have to go out.
Wow.
My family has about 6 medical people on the front lines right now. My sister is in Sierra Leone. She's a medical doctor with ECOWAS. My brother-in-law is a medical doctor. My other sister is a nurse in the US. We have them scattered all over the world. So it really hits very, very closely home. And I do hope somehow one of them will hear this. We just want them to know we appreciate what they are doing. We consider them an excellent representation of all that is good about human nature. We do hope that people will remember that staying at home, obeying all the social distancing regulations actually makes sure that these people come back home to us. And great idea, Yemi. Thanks for creating this platform to thank them.
Oh, you're so welcome. And thank you for calling all the way from Nigeria to appreciate all the frontliners in the different parts of the world. And I really pray as well for your family members who are frontliners, that the good Lord will watch over them as he will with all frontliners in different parts of the world, and they will be safe. As one would expect, we have lost lives. We have lost frontliners in the line of duty. And I do send my condolences to families of people whose lives have been lost in the course of trying to ensure that everyone in the world is safe right now. I suppose one good thing is if people obey the call on all of us to stay at home, we will be helping the frontliners do their works even easier. So thank you so much for your call.
Absolutely.
And stay safe yourself, okay? Stay safe.
Will do.
Thank you. Cheers. Bye-bye. So there you go, Mr. Olaleye. That's a call from Nigeria. Somebody appreciating frontliners like yourself. How does that make you feel? Okay, I think Mr. Olaleye's visual is frozen there. But we really do appreciate you. Thank you so much. We'll try and reconnect you back. It's just brilliant to see the great things that our frontliners are doing. Now, there are a couple of messages that I would love to share with you guys today. Messages that some you perhaps have seen, some you may not have seen, but these are messages that are encouraging us as people, just telling us how we should conduct ourselves at this very difficult and challenging times. So I'm going to share this particular one with you, which tells us about how we are to look after ourselves and keep safe. You perhaps have seen it, but if you haven't, well, I hope it speaks
brothers
to
and sisters. My name is Dr. Bajwa. I'm an emergency physician working on the front lines in Canada. I'd like to share with you what's happening on the hospital front, something that most people right now are not seeing, and I hope to God they never see. This virus is spreading so fast in the world because it's such a cunning little virus. Most viruses are either spread quickly, like the flu, or they're serious, like SARS. But this one is both. One of the main reasons why it's spreading like fire is because it starts to spread even before you know you have it. I might be spreading the virus right now and not even know it until I get sick tomorrow or the next day. The numbers that you see in the media are not accurate. They show only the people who have been tested that are positive. There are so many more people out there who have it, who are spreading it, and we don't even know about them because they haven't been tested. Canada's doing a pretty good job. We've recently increased our testing in the past few days, but it's going to get a lot worse. The healthcare system, the workers are doing the best we can. I might sound like an alarmist, but I can live with that. In fact, I'll fall over in happiness if I'm wrong. I'm just trying to stress the importance of what public health is trying to tell us. We need to get away from each other. Don't have friends or parents over. Don't go to large gatherings. FaceTime your friends. Call them, email them, do whatever you have to do. Just don't go see each other. Don't be in close distance to each other. Don't take your kids to the playground. In fact, why don't you act like you have it? Act like you will get it. That's the way that you'll help yourself from getting it, and that's the way that you'll help stop it from spreading to your family. If you have to go out for groceries, the pharmacy, then wash your hands. Don't touch your face. That's how it gets in. Create some friends and family groups and take turns going to get groceries. Just remember to leave the groceries on the front door and not go in for a hug or a kiss. Your actions today will determine what I'm seeing 2 weeks from now. We can handle many sick patients, but there's a limit. After that, well, I'd rather not say. We can get more ventilator machines, but who's going to run them? We only have a limited number of people, and even some of them are going to get sick. We don't have the time to train new ones, so we've already asked retired doctors, nurses, and other healthcare workers to come back from retirement to help us. But even that's not going to be enough. I cannot say it enough. Social distancing, staying home, washing your hands. This is what's going to get us through this tough time, not some magic medicine or vaccine. They are going to happen sometime in the future. If we can all do this together, then this disease will hit us like a small hurricane and pass with some moderate damage. If we don't do this, then a tsunami is coming. We all have to remember that all of humanity is suffering right now. The virus doesn't care what color your skin is, how much money you have. We're all in this together. We'll pull through this together. The worst thing that could happen is that you did it for nothing. But the odds are that's not true. When you show up at my emergency room door, I promise to do what I can for you. In return, will you promise what you can do for me? Just stay home. Please.
The major thing that our frontliners are asking us, especially the healthcare workers, they're asking us, please stay home. That's the best we can do. Stay home. If you don't have a need to go outside, if you don't need to go shopping, which is an essential action, if you're not going to work as a frontliner yourself, please stay home. It's not the time to have parties and to try and meet up with people, to connect with friends and family, or to play football in the front field. This is not the time. Please stay home. It's the least we can do for our frontliners. I'm being joined. I want to take a quick call before I take another guest live. This is a call coming in. Hello, good evening. Welcome to Sharing with Yemi.
Yes, please.
Who's calling, please?
Hello?
Can you turn down the volume of your phone or your laptop on Facebook so we can hear you?
Yeah, I lowered down.
Okay, thank you. Very good. Who's calling us, please?
My name is Christine Young.
Hello, Christine. How are you today?
I'm good, yeah.
Very good. Thank you for calling us on Sharing with Yemi. Do you know any frontliners?
Yeah, well, to be honest, Yemi, I'm a frontliner myself.
Oh, goodness.
And I work in a shop, and but like, you know, the people coming in, you know, you're at risk, you know, and also I know people in working in hospitals too. I know a good few people working in hospitals doing a great job, and I've heard that postmen now are going to help old people, so they're frontliners too, and helping people, you know, heroes of the community. But I think we are all in our own way heroes if we do the right thing.
Absolutely.
By washing our hands, doing everything right. We're all here. We can all be heroes, every one of us, you know.
You are so right, Christine. Every one of us can be heroes and sheroes. We just have to do the right thing. And that's all we're required to do. Do the right thing. Like it said, I mean, obedience is better than sacrifice, you know? So it's better to do the right thing. Do you want to give a shout out to any colleagues of yours that are frontliners like yourself? We appreciate you, Christine, for the great work you're doing to ensure that we are safe in all the different paths around you. Do you want to give a shout out to any frontliner that you know? Do you want to say hello to anybody and say thank you?
Yeah, I will.
Yeah. So do you want to mention anybody's name and say thank you to them?
Yeah, I just want to say thank you to my great friend, Marianne Murphy, who's working in the hospital and just doing a great job. And I just want to say really thank you to her. And thank you to all the nurses that come into her job, to Sinead, and lots of different, I can't think of names now, Yemi, but lots of different people who come in to her job every day, who work in the hospital and who are doing a fantastic job. Thank you so much for risking your lives for us. And we will do our best to keep you safe too. God bless.
God bless you, Christine. Thank you so much for calling. And God bless all our frontliners. We appreciate you. Today is our appreciation day for you. And I've got joining me Adeshina David. Can you hear me, Adeshina David, wherever you are? Let's see now. Hi, thank you for joining me. Can you hear
You
me?
do? Yes. Can you hear me too?
I can hear you. I'm doing great.
Oh,
Where are you connecting with us from today?
I'm in the United States.
You are in the United States. How is
Yeah.
Trump?
It's
That is basically, I can guarantee that's the first question you get every time you tell people you are from the
I'm
States.
telling you. I'm telling you. I don't know, maybe we are his baby or he's our baby. Either way, we are stuck together.
Wow. So tell me, what are things like in the States for the frontliners?
Everything is for the frontliner. It's kind of like it's a little bit busy for them. My wife is a nurse, so she's been up and down. Like every one of us is at home except for her. So it's she's the one facing the risk right now, having have to go out, take care of all the people that are infected. I mean, physically touch them and all that. So we just have to all we just can do is just we just have to pray for them and hope that God help them and start with them.
Do you get concerned at any time about her? You know, coming home after work
For
and
sure.
yeah.
Yes,
So
I do. Each time she get home, before she hug anybody or touch any one of us, she walks straight to the bedroom, take our uniform, put it in the laundry machine, and just try and dry clean everything, and go into
wow.
the shower herself, so that if there is anything, maybe not, she can be clean before she starts playing with the kids and talking with every one of us. So it's kind of like everything is kind of like changing. You know, your wife comes home, before you want to give her a hug, now you can do that. You just have to wait that 5, 10, 15, 20 minutes for her
Wow.
to shower and get ready again.
Wow. It's a difficult one for the family, isn't it?
Yes, yes. And you know, having to throw the cloth in the laundry means that more electricity bills. Because
True. That is something that people haven't actually thought about. So the
yes,
front runners have to come in
yes,
and do that every day.
yes. Every day she come back from work, she have to do that, because I mean that's the precaution.
Wow. I'll tell you something. I have heard a few people who are frontliners themselves who have had to uh, leave the kids over to family,
Yes.
to their moms or to their dads to help them look after because they're concerned that they might bring something home. And but yourself as it is, your wife constantly comes home every day. What are the routines that you yourself and the kids do aside from her coming home and stripping and then taking a shower and throwing the clothes in the washing machine? What routines do you yourself have to do, yourself and the kids, to ensure that you're
Um,
keeping safe?
Yeah, I have to take care of the kids, prepare the food for them. It seems now that they are home, they kind of like eat more than before. Every little minute, and Daddy, what can we eat? What can we eat? What can we eat? And coupled with the fact that I'm also working right now, I'm in the office as I'm talking. I mean, at home in the office as I'm talking to you, working. You might be hearing some computer noise in the background. So I have to also they are sharing my attention. I have to be focused at work. I have to run to attend to them. We just have to adapt. We pray that it's a temporary thing. It's not something that's going to last for too long before we start breaking down, even without the virus. Because before you have to run out to them, they need something, and they will fight. You have to separate the fight and all that, and come back to whatever you are doing in the office as well. But it is what it is. We just have to find a way to adjust.
Wow. Well, we want to say thank you as well to you, a member of a family of a frontliner, because you all also play a big role. I mean, you literally are at the receiving end. If anything is to happen at all, from your wife coming home, you'll be perhaps the first to get it.
Yes.
So you are also heroes and sheroes, and
Thank
we
you.
really appreciate at a time like this.
Thank
And
you.
we would appreciate if you would please give your wife a massive thank you from us all at Sharing with Yemi, to say thank
Thank you.
you for ensuring that people are treated, people are safe, people are better, for the great work that they're doing out there. Thank you so much for joining us this evening.
Thank you, ma'am. Thank
And
you.
keep keeping safe, okay? Keep keeping safe.
We'll do that. We'll do that.
God
Thank you
bless
so
you.
much.
Thank
Bye.
you. Thank
You're
you.
welcome.
And so, I mean, it's just a fantastic evening today, being able to say thank you to our great frontliners. And we're going to share this.
People succumbing to the coronavirus is overwhelming every hospital in northern Italy. The staff are working flat out, trying to keep these people from deteriorating further. They're trying to stop them from dying. This isn't an intensive care unit, it's an emergency ward. The ICU is full. People have only just arrived here. This is an absolute constant. This killer pandemic is virtually out of control. Are literally gasping for air. The plastic bubbles the staff struggle to communicate through attempt to equalise the air pressure in the lungs. Nobody thought they'd be treating so many so quickly. And it's not like flu. It is chronic pneumonia, and it is killing hundreds each day.
There are now 15 patients.
The doctors say they've seen nothing like it before and are warning other countries, especially the United Kingdom, that they will see it as well.
People who keep describing this as like flu, it's worse than that, no?
No, it's totally another thing. I think it's most pneumonia, most pneumonia than flu, because most people get pneumonia, and as I said before, it's a very severe pneumonia, and so it's a massive strength for every health system.
This is the main hospital in Bergamo in Lombardy province. It's one of the most advanced hospitals in Europe. But it's the most hard hit of all the hospitals in Italy. The town is the centre of the epidemic here. This isn't a ward, this is a waiting room. Wherever you go, people are on gurneys, in corridors, in meeting rooms, they're everywhere. All the medical staff urge other nations to see what's happening and lock their nations down right now or face this.
What I would suggest is just shut down to stop all the outbreak, and not coming in this kind of situation that is very, very difficult to manage.
Can I ask you personally what it's been like?
I never felt so stressed in my life. I'm an intensivist, and I'm quite used to, intense moment and choices, and people are critical and will die without any, treatment, and you make the difference. But when you arrive at this point, you realize that you are not enough, and maybe we are 100 anesthetists here. We are doing our best, but maybe it's not enough.
We are performing the test for the nasal swab to detect coronavirus.
The problem facing health services across the world is that when the infection curve goes up, it rockets, and all the resources, all the testing, all the supplies are used up instantly. Multiple hospitals all at once.
What's staggering is that Italy is doing a lot of testing. Thousands upon thousands are being tested. So far, about 4,000, the numbers keep changing, have actually completely recovered. The crucial point is that about the same number are dying. They're sort of neck and neck. And it seems you either live and recover or you die. Something nobody expected.
Bergamo wanted us to see this to show what a catastrophic emergency nobody has experienced before looks like. Here they're calling it the apocalypse, and this is what it looks like. And their message to us is simple: get ready.
Wow, a very powerful report there from Sky News, by the Sky News reporter, Stuart Ramsey. And this was a very powerful one, just showing us how critical situations are in the hospital and how exposed our frontliners, especially our healthcare workers in different parts of the world. That was just a report from Bergamo in Italy. And it's the same all across Europe, it's the same all across Africa, different places in the world. Healthcare workers are doing amazing work, and they're constantly exposed to being infected by this virus. And so the least we can do is to, first of all, appreciate them, show respect, and then stay at home. When there's no need to go out, we stay at home. I want to thank everybody who's been sending in comments, and I would just take a few here before we go today. Debola says, thank you so much to our great health workers. Tunji says, nice to see our health workers doing amazing work. Very well done to our frontliners. You're all amazing. That's from Comostic Total Events. Thank you so much. Bola Akonde says, beautiful rendition, guys. That was to the kids who were singing earlier on. Vicky Robert says, thank you, Yemi. This is touching. I appreciate this. You're very welcome, Vicky Robert. You're a frontliner yourself, and we appreciate you so much for the great work that you're doing. Thank you so much, Faith Ebouvoir, for your comment as well, to say well done to our frontliners. This is one from Olayinka who says, it's really difficult for me and my husband, as we're both healthcare workers. Oh, wow. Especially with kids at home. The trauma of avoiding hugs from the kids after work. You go to work with faith, what you wish the government could help with the child care of kids and couples of frontliners. I hear you, Olayinka, and I feel you. And we will continue to pray for frontliners like yourselves, We'll continue to pray for God's protection over you and for his guidance over your families as well. Thank you for keeping us all healthy and safe. Phoebe says, great job to all those who are in the front line during this time. Thank you, Phoebe. Ifeyiwa Nwike says, hi, Yemi. It's good having this. Thank you very much. Esther says, massive thanks to all our frontliners. Thanks for doing the great work that you're doing. Collins Olaniyo says, also appreciate those that are working at supermarkets, the Gardaí, the postal services. Absolutely. They're all frontliners as well, because they're out there really ensuring that we get all our essentials. Thank you. You're putting yourselves at risk as well, and we really appreciate you. Thank you so much. Joanna, who is a healthcare worker herself, says, fair play to my colleagues out there. May God bless you all for the action and the act of selflessness and your service. Thank you, Joanna, and thank you to your colleagues for the great work that they're doing. So Raymond says, stay at home. He says, stay at home. The doctors are annoyed due to the pressure. Yes, the more you go out, if you have no reason to go out, the more you go out, the more pressure you put as doctors under, because you're exposing yourself. And if you do catch anything, you'll have to go to the hospital. So we want less and less people in the hospitals. So, I mean, you heard that video there, that doctor in Bigamo he said, I have never been so tired in my life. You know, they're tired physically, they're tired mentally. It's a challenge. It's not an easy thing to do. Gladys Otono Asenohai says, the laundry bill and emotional and physical pressure of being cautious is huge. I completely agree with you. Just thinking about that alone in itself is trauma. So I completely agree with you, and thank you for that comment. Thank you all so much for your wonderful comments, for being a part of this. Those are the comments we're going to take today as we're wrapping up the show for this evening. I mean, honestly, the least we can do as people who are still healthy, who have not tested positive for the virus, I mean, it's simply by God's grace. It's sheer grace of God that we are still here healthy. And many people have lost their lives. Many have lost families. Many have lost friends and colleagues, you know. And so we take this moment to really say a big thank you to all those who are working in the front lines. And I want us to take just a few minutes, 1 minute really, to just remember all those who have lost their lives. So if we will just take a minute, wherever you are, just take 1 minute. May the souls of the departed rest in peace. Thank you all so much for your great work. Ireland to clap for healthcare workers at 8 p.m. tonight. I am so glad that we're doing this evening. And so tonight, wherever you are, at about 8 p.m., I would love for you to join the rest of Ireland to give a round of applause to all our healthcare workers. And we're actually going to start that here right this evening. So if you're joining us on the show right now, watching us, sharing with Yemi, I want you to begin to put your hands together for all our frontliners. Please, in your comment section, if you would give a clap, please give a clap, a round of applause to all our healthcare workers, all our frontliners, the post, those who work in the postal service, those who work in the shops, who ensure that all the shelves are restocked all the time. Everyone who is out there doing their best for us, we applaud you today. Thank you all so much. God bless you. God bless your families. And I want to leave you with this beautiful video, right? This are guys in Dublin, right? And I tell you what they're doing. They're out there playing bingo, but they're maintaining absolute social distance. And it's incredible. They're finding a way to replicate what happened in Italy, but this time they're doing what they love to do. I hope you love it.
Do we have a check down there? On the left? Yes? George is going to go up. Well done. George is going to go up. Second balcony down the end.